Hello, everyone. Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I'm your host and always excited to be here with another incredible guest. We were chatting before and we were like, wait, we got to stop and we got to hit record because we have so much in common. And we're just very excited to begin this conversation, but very happy to welcome Kristen here on the podcast today. And we're going to start with the question I always start with, which is basically just what's your RDH origin story? How did you get into dental hygiene?
Okay. Well, first off, thank you so much for having me. I'm really excited to be on and I appreciate the time. It was so great meeting you and our chatting before too. It was really fun. Okay. So my RDH story. Well, to be honest, I didn't know that I wanted to be a dental hygienist. So freshman year at Oklahoma State University,
Go Fox.
it's so funny that we both went there. We found that out earlier that we both went to OSU. So I go to OSU. I knew I wanted to go and be in healthcare in some way. I wasn't for sure what. I knew I wanted to help people. I wasn't quite sure. In my freshman year, they had this huge, in one of the biggest classroom in their auditorium, and it was just like a health. I can't remember what it was called, but they had. You are shaking your head. Yes. Did you take that class?
Yes, I was
They
in the
still have
class.
it.
Yes, and that's how I became a dental hygienist from the hygienist that came to that class. Yes,
Shut up. Same.
that is
Same.
so crazy. Yeah.
So I was there. They've been doing this a long time. And I guess I would say, like, way to go, OSU. Please continue on. Apparently, this program is working. That is why I chose hygiene as well. It was everybody came in. I certainly liked nursing. I thought about just MD. Physical therapy looked pretty interesting as well. And then when it got to hygiene, I guess I kind of remembered that, oh my gosh, I love my dentist in my small town that I came from and his hygienist. I feel like I hear that a lot from hygienists that we're like, oh, we loved our dentist and our hygienist. So I thought, oh, that will be great. And I knew at some point I would like to, one of my goals was to get married and have a family. And I was like, okay, then I could take some time off and I could go back into the career and not feel like I have to start at the bottom of this corporate ladder structure. So, yeah, I just kind of picked it because of that, to be honest with you. And then I said, you know what? Well, and I think the person that spoke that day, I wish so bad I knew who it was. But they were like, hey, go out and try to get a job, a part-time job, assisting or just anything in the dental office and see if you even like it. So that is exactly what I did in Stillwater, Oklahoma. I went and got a part-time job, dental assisting, which I really enjoyed. I was like, oh, yeah, this is my cup of tea. And side story on that, the very first day that I sat across from the dentist and was actually assisting him, he was showing me how to do some things and he was going to seat a crown. And of course, I wasn't doing it right. I think I wasn't like aggressive enough. I wasn't getting in there and doing the things. He grabs the high speed out of my hand and like rakes it right over the back of the patient's like tongue in the back of the throat, which of course they gagged and swallowed the whole crown. And I remember just looking at him and making this eye contact, like, that was all you, bud. Like, that was not me. And he just kind of sat there. And that was my first experience chairside was this dude grabbing something out of my hand. He was so delightful though, but it really was like, it's on you, boo. It was so funny.
My face right now, if anyone could see it, I was literally like, stop. That did not happen. Okay, wait. So the patient for sure swallowed it. They didn't have to get like a chest x-ray or anything?
It was so long ago. It was a swallow. There was no chest x-ray. Should it have been now? I don't know, but I it felt like it was in a spot that it was going to work itself out.
That is so funny. Yeah, I think it's like so crazy that we both went to OSU. We both took that same class. And so I actually recorded a whole podcast episode, probably almost maybe 2 years ago. I don't know. That was called My Dental Hygiene Heroes. And it was all about random hygienists who helped me to get where I am today. And I said, and some of them, I don't even know who they are. I don't know their names, but I talked about her. And I wonder, I'm like, was it the same person? Like, you just never know. And you're right, that makes such a big difference. So that kind of makes me think like I should be getting out there talking to like I know I'm doing it right now, but like I should go to my local high school and be like, "Hey, do y'all need a dental hygienist to come talk or something like that?" Because you never know when one conversation that you have with someone could put them on a totally different trajectory. And that's what happened for me. So I love that that happened for you. So you take that class, you become a dental assistant. And my first dental assisting job was also in Stillwater, Oklahoma, but I worked at the oral surgery office. Yeah, yeah. And on my first day, they were like, well, I don't know if it's my first day. I know I had to go in and shadow surgery for the same reason, because they're like, if you're going to pass out, like we need to know beforehand that if you can handle this. But then my first surgery was tori removal, which is excess bone removal under the tongue. And they took a chisel and a hammer and literally were chiseling the bone off. And I was just like, this is the coolest thing. I loved it. I loved it. But I was like, wow, what have I gotten myself into? So, look at the opportunities you and I had in Stillwater, Oklahoma. I love that. Okay. So, what did life look like from there? Where did you end up in hygiene school?
Okay. So, and I mean, you tell me what it was when you went. OSU did not have a dental hygiene school program. Like you had to go somewhere else.
Yes.
Okay,
Yeah.
same with me. So I only actually applied to and looked at 2 schools. Again, I wanted to be kind of somewhat closer to home, so I looked at the one in Wichita Falls. Is it Midwestern State?
Yeah.
I remember driving all the way down there. I think I went down from Stillwater to Wichita Falls, interviewed, and back in one day. And then I also interviewed at OU, and then I ended up getting accepted to OU. So I went to OU Dental Hygiene School. Where did you go?
So I went to UT Health San Antonio. So I came back to Texas. Yeah, I have a long twisty story, but basically, I had applied to dental hygiene school. I didn't get in, and then had like a gap year, and I decided I'm going to go back to OSU, finish my bachelor's, which is what I did. And I had planned to go to dental school. That's what I thought I wanted. Well, I apply. I didn't get into dental school, and so I was like, okay, I want to keep moving forward. I'd been an assistant for several years at this point. I was like, let me try hygiene again. So the reason why I moved back to Texas was I was losing my Texas residency and there were more schools in Texas. So I had
Mhm.
better chances of, and I would have in-state tuition. And so I was like, okay, let me do that. So that's how I ended up back in Texas. But yeah, yeah. So, I guess we kind of were like competitors at that point, UT versus OU, right?
Right? You had your own thing going on there. Okay, so then I go to OU, which was again, it was at the Health Science Center. Wonderful experience, loved it there. I mean, I just felt like they were really great. They were here to help you. It was like, if you can get in, we want to keep you in. We whatever you need, whatever you ask for, as long as you're doing the work, right? But I felt really fully supported. It was a really great experience. Well, let me be clear. I felt like I was really supported. It was so hard. So I did learn that was for me, that was probably one of the first times that I really kind of struggled. Like school, I could study and it was fine. It wasn't the hardest thing for me. And I got there and I was like, wow, I'm taking how many classes? And the sheer volume of information that was expected to be implanted into my brain and remembered and then tested on. So back then, we did full body cadaver anatomy.
Wow.
So we did it with the PT students. And then, of course, that was like their slow semester. Well, not their slow, like, do they have a slow one? But they were like, this is really important. Like, this is your main class kind of deal. Whereas we still had all of our dental hygiene, dental classes. It was like they just threw that in there. I felt like they threw us in there to like check this box. You have to know this stuff. And I have just never felt so incompetent and just like they were just so smart and they had their stuff together. And I felt like the most yeah, I mean, I loved lab. I got all my lab points, but it was just remembering all that. I remember being a little bitter about why do I have to know nerve innervations of a toe? I'm working in people's mouths. So, like, there's like a little bit of animosity, but whatever, I got over it. So, the other thing I love too about OU, and I would tell hygiene students this right now when you're in school, yes, you're there to learn, do all the things, explore, ask all the questions, but you're there to network, meet people, and, try to have as much fun as you can along the way, right? Like rein it in, don't get too crazy. But your networking is a thing. I would say I didn't know that back then. And maybe I did it a little bit and didn't realize it, but it was one of my clinical instructors. We were talking and she said, hey, so when you graduate, do you have plans? And I said, no. And she goes, where are you? I was like, I'm up in Edmond. I'd love to stay in Edmond. And she goes, let me see what I can do. She goes, I think I might know somebody that's looking to hire. And don't you know, I had that job as soon as I graduated in May. And it was as a dental assistant contingent on us, as soon as I think it was like in July, we got our board results and it was move on over to the hygiene side. And it made the transition easier as far as I had already been an assistant there, knew the office, then I could go over. It was still stressful. You know how that goes, but made it a little less stressful. But I got that job from one of my instructors helping me with leads. So I would say don't underestimate the power of networking and just even other students in your school, even dental students. You're good. I ended up also working for another dentist. We both graduated the same year and we didn't even really know each other that well in school. But point is, our paths crossed again later. We're like, oh, yeah. And then loved it, had so much fun with her as well.
Yeah, I love that. And our stories have so many parallels, which is awesome. I should probably mention once I got into dental hygiene school, I realized I was never supposed to be a dentist. I was always supposed to be a hygienist. You don't know. It's like
Really?
they say when one door opens, another, one door closes, another door opens. For me, I had no choice but to go through the window into dental hygiene. It was like where I was supposed to be the entire time. But when I got there, because I had dealt with so much rejection, like I kept being told, no, 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 like from the first time I applied to dental hygiene school, which I didn't get in. And then all the times I applied to dental school, it was just rejection after rejection, which now I'm like, sure, reject me. I don't care. I'll find something else. But in that moment, when I started dental hygiene school, I was like, I want to make the most of this opportunity. Like I was finally given a shot at something. And I did the same thing. I was like, network, I got involved. And I had the exact same thing where my director, when I was graduating, she's like, hey, this person's looking for a hygienist. Like, I think that you would be a great fit, and I had a job right out of hygiene school. I worked as an assistant. I got my license really fast, but I worked as an assistant for like 2 or 3 weeks. And then I started hygiene. So, yeah, I mean, it is all about those connections that you make, and you never know where one of those connections would take you. So I think that that's something that maybe we don't think about enough. Who are we talking to? Who are we making friends with? And at least professionally, right? You just have to have a professional relationship. That's the most important thing. So love that. Great advice. Okay, so in dental hygiene school, you're toughing it out in the cadaver lab, right? What about clinic? Yeah, what about clinic? What was the hardest part of clinic for you?
I really did love my clinic time. I feel like I enjoyed that much more. I feel like most of us can say the hardest part was like waiting for that permission to proceed check, right? Every little thing. It was like, come on, man, get over here. I got stuff to do. It was like just waiting and waiting and waiting your turn. No, the hard part, yeah, I just think was everything was so new.
Yeah.
Just the dexterity of it all, that type of deal, the teeny tiny, and it was like, this is how you sit. Here's your posture. And then don't forget this. And, you're trying to sit a certain way and not stab someone subgingivally at the same time. But did I even get it? Closing my eyes. Do I feel anything under there? Right. Just all of the things at once happening to me too was really hard. I had one of my girlfriends at hygiene school. I wonder if they still do this. She is a lefty and they basically turned her into a righty. And there was a point I was like, I think this is going to break her.
Oh
And she was
no.
like, just imagine. She goes, go sit down and try to do everything, all these teeny tiny things with your left hand. And I remember one day just trying to like write my name on paper and going, wow, she made it. She's doing wonderful in life. So there's that, that I just, do they still do that? Do you know?
I think it depends on the program. I hate to say maybe some like old school programs may still make you do that, or if the clinic setup does not basically support a left-handed clinician, you may have no other choice. But I think we're trying to get away from that in
Okay.
education. Yeah, yeah. And I've actually just through networking, I met this incredible hygienist who's left-handed, and she's trying to basically be a support system for those people who are left-handed clinicians who are struggling because you may be a lefty and only have right-handed clinicians. And I always felt bad. I was like, I think I should sit down, and start learning left-handed so that I can help left-handed students. But yeah, thankfully they really don't do that too much anymore. But good for the ones who've done it. I know a lot of people who have gone on to keep practicing with their right hand even though they're left-handed.
Right. I went in when I was in between jobs and did some temp work, and the dentist and the hygienist were left-handed. And I went in and I was like, I had that moment of, now I know what you guys have felt like all these years. This is awful.
I know, I know. And like you have to move everything around. And I've worked with a few left-handed hygienists, and I would always try and be like, oh, I know they're coming into my op tomorrow. Okay, let me move everything to the other side. And I know it's so crazy. Okay, so where were we? So you're in dental hygiene school, you're learning, the clinic, the hand skills. And I agree, that is one of the hardest parts because at some point you've never done these things before and you see some of your classmates that just pick it up and they make it look natural and I'm over here like, am I even holding it? Like I was just like, I'm gonna drop it. That was my thing every day. I'm like, I'm not holding it, right? It's just gonna fall out of my hand.
Yes, I had that. Did you have dreams also about, literally getting underneath the calculus and engaging and put like I remember having vivid dreams about, and this is how you'll do it. This is how you'll do it.
Yeah. When I first graduated and I started practicing as a hygienist, I dreamt about scaling. I mean, all the time, all the time. And you know what's funny? Like, people have recurring nightmares. I only have two recurring nightmares. One is that I'm sitting in a class and I didn't study for the final, like I'm there for the final, but it's never hygiene school, which I think is hilarious. It's never hygiene school. It's always like before, like at Oklahoma State or in high school. It's always one of those two. The other recurring dream is that I'm running late and I have patients in the waiting room. And I'm like, man, I need to go through some intense therapy for whatever sparks those recurring dreams. But yes, I definitely. But you know what the power of that is? Visualization is a strong, powerful tool to help you build those muscular skills. And I tell my students that all the time. I'm like, close your eyes, picture it. What would it be like to get under the calculus and do it? I want to know, do you remember a time where all of a sudden you just realized you were doing it? Like all of a sudden you realize you're like, I'm not thinking about sit up straight and hold my hands in there and do this and do that.
Wow, I don't know if I have like a vivid moment of, hey, I'm just doing it. I feel like if it was even in hygiene school, it would have
Probably not.
definitely been close to the end. Yeah, I was like, I don't have a moment of, oh yeah, I'm just doing it now. I
Yeah.
wish I did.
But I think that's actually not a bad thing to not remember because what that means is you just like eased into it. Like all of a sudden you were doing it to the point that you never even had to think that, oh, I'm doing it. Right. Well, for me, I remember looking in the mirror and like being like, I'm doing indirect vision right now. Like, I'm actually doing it and I know what I'm doing. And I think that was like it was definitely after graduation, probably like 6 months in, and then, maybe a year.
Oh
Is
wow.
that crazy? Yeah, I mean, it takes time.
Okay.
Yeah, it takes a lot of time. So, okay, so you get through dental hygiene school. I really wanna dive into your career progression. I really wanna talk about what you're up to now. So, lead us kind of on the path. You go to this first job, you're working as a clinician, but what happened after that?
Well, I will tell you, I was like you after hygiene school. I was like, I think I might want to go to dental school. Like I investigated that as well. I went in and I even found out I wouldn't have to take our anesthesia class again. It was like a radiology. So they're like, you could come in this many hours under. So we have that overlap too. It's where my brain was. But honestly, I was too scared to apply. The amount of debt to me, I was like, this is a crippling amount of debt. And I'm so terrified of it. So I feel like that is a whole conversation that needs to be had too, is student loan debt and things like that. But anyhow, that is why I didn't at that time, but it does have to do with the story I'm going to tell you later in my progression. So I graduate, I work in admin basically until I get married and we move. So then we move, and that was a general practice in Edmond, which I loved. It was one dentist, one assistant, one front desk, one hygiene, and just loved it. It was a great place to be in to start. How long was I there? 9 years, I think, maybe. And then what happened was my husband had a job, I had a job, and we were just kind of thinking about life and what we want to do. And it came back around. He said, you know what? I'm thinking about applying for this new job. They've got about a 2-year wait period. And I said, well, I'm kind of still thinking about dental school. Why don't we both just start our application process and we'll see wherever we go is where we were supposed to go. So there I was again looking at dentistry and do I really want to do this? I felt a little bit better having had some years under my belt of working and like, okay, we could probably do this. And he was very supportive. He was like, wherever we go is where we go. And then, of course, he got hired, I think, in like 6 months. And I was like, well, that went fast. Okay. So off to Laredo, Texas, we go for his job. There, kind of the same thing. I started just looking and trying to research what I wanted to do. And I ended up getting hired in a periodontal office there. And it was the only periodontal office in town. Fantastic. I love, love, love that job and that crew as well. We were there for 5 years, and it was just so interesting to learn, to learn a lot of things. At that time, Texas did not allow hygienists to give anesthesia. And that was a bummer because my boss was so great, but we both had conversations. He was like, "Ugh, you could literally be getting them numb and doing all of the things." He was like, "Why aren't we doing this?" I said, "I know, like, come on, man." I mean, Texas does now, so that's wonderful. But at the time, coming from a place that I had already been doing it for many years and he knew I could and he wanted me to as well, but we're like, "No, it's a stinker. We have to follow the law." So we did not do any of that at all, but we always joked how helpful it would be, and now I hope he has a wonderful person doing that. But I loved it there, and then from there, we go to Northern Virginia. My husband's job again, I just follow him around. So then we go up to Northern Virginia, and I get a chance to work at an office, yet another fantastic place. I've had the best places to work, I have to say. Like, I hear horror stories from some people, and I love to lean in and listen to them and really hear all the stuff, but I was like, I've never personally had to deal with that, and I don't think that I would survive long. Maybe my instincts to just run away from that situation. I don't know. But so I worked at another great office, and they did assisted hygiene, and they did it right. So that was another, like, here I am again getting to learn a whole different way to do hygiene and give phenomenal care and really get to do a lot of same day. It was just another wonderful experience. How long was I there? 6, 7 years? And then we move again. This time we're off to San Salvador. Loved it there. Dental hygiene, at least the time that I lived there, was not a thing. It was the dentist, and then the dentist did the cleanings, the dentist did all the things. So I did, oh, you know what? I take it back. I did experience a little bit of a crazy story. And the funny thing was, it was an American trained dentist practicing there that I was there for a short period of time and definitely used my survival skills to 10-4 out the door pretty quickly. Then I found another wonderful dentist, a Salvadoran dentist. He was an ortho doc. He has this beautiful modern practice, but he said, "Yeah, you want to come do hygiene a couple of days, whatever you kind of want to do, we'll let you do hygiene out of here if you want to." And I did, and it was the best experience ever. So we did that, or we lived there for 2 years to Oklahoma. Next was Oklahoma, and I did some fill-in trying to this was the thing that I felt like was a little bit stressful. I don't know if it was the time of my life or what was going on in the world. Going back to my home state, right, where I had graduated and I had connections and had worked, that was the hardest time for me to find a job. I don't know what it was. So, I did some fill-in, but long story short, I did find my way into a practice that was really transitioning into being a biological dental practice. The learning curve for that, I felt like it was hygiene school all over again a little bit. It was
Yeah.
like, wow. And that I loved. I feel like that's the bee's knees. It's definitely super educational. It was all about education, educating the patient and then us too. And then for me, that practice grew into working with patients that really want to heal. Like, they came there to heal. They are bringing their A game. They are coming with information, and you better be bringing your A game too. I learned a lot from my patients there too. We would be talking about other things. That was the first time I got to really start networking with other healthcare providers and talking and working together, and to see how beautiful that situation is, and to see just how great patients heal and how life-changing it is, and the exponential practice growth that you can get, and the happiness from within that you have, and really feeling like, "Oh, wow, I'm stepping into my role as a healthcare provider." I loved it, loved it. And then from there, again, my husband's job, here we are in Bangkok, Thailand. We've been here for 3.5 years. I do not practice clinically here. This is a situation where dental hygiene, oral health therapist isn't a thing. It's the dentist does the cleanings, and they are very strict with their work laws here. They do not want you taking any job that a Thai citizen can have, which is understandable. So I don't practice clinically here. Back to my Oklahoma in biological dentistry. That's when I discovered the microscope, and at that point, that was the first time I had ever heard of it being used that way. Like, I remember taking microbiology at OSU, right? Did you take that class?
Yes, yeah, but I took it at home over the summer. I took it at Lamar in Beaumont.
Yeah,
So, yeah,
yes.
I didn't take it at
So, I remember using a microscope in the lab, and I think we took, like, cheek scrapings, things like that, but we did not look at plaque. So, I think we might have looked at saliva, but it was just, like, something I did, it didn't really register, and then when my boss one day, she was like, "Hey, have you ever heard of this, like, using a microscope?" And I was like, "No, tell me more." And she was like, "I'm kind of interested in it, like, I just heard that it exists." And so, she was like, "If you wanna do this, it's your baby, like, I'll support you in this, I'll get one, we'll get the training, and we'll move forward." And it was a total game changer for me, just seeing how patients loved it and how patients it got their attention. They were leaning in, they were asking questions, they were engaged. Very quickly, I learned that the microscope is basically an intraoral camera except for the oral microbiome. So I feel like I tell people all the time, would you work without an intraoral camera? Like, you see how much production that puts on your schedule. Microscope is the same exact thing, except it's a video. You can take still shots if you want, but it's really fun to see the movement. That's the important part, and how things interact with each other. So now you can't go back. And every hygienist that I know that uses a microscope, she's like, I couldn't work without one now. Like, I can't unknow that information. So when I first started using it, right, I'm having all these epiphanies, love and life. And then you get to this point that you're like, why didn't I already know about this? And then you also are like, why isn't everybody using this? Like, it's so simple. It's not rocket science, right? It's been around forever. We're not reinventing the wheel, people. It was mind boggling. So I found myself talking about it more and more. Hey, to my other hygiene friends, have you seen this? And then I just remember really loving it and thinking everybody at least needs to know that this exists in the universe, right? I found myself talking about it more and more. And then, there was 2020 and all the things that happened in 2020. Again, the practice I was with was wonderful. We traveled for education a lot together. We love traveling, but then there was no more travel. And I just thought, man, I'd love to share this more. Okay, I think I might start training offices on it, because I was like, I can do that a day or two a week or whatever, and I can still do my clinical time. And then the 2020, and I was like, well, what could I do now? I don't know. How would I share this? Then I thought, everything is online. Like, everybody had moved to Zoom, right? So I was like, there's still a way to do this. And I remember when I got trained, you had to pay someone. Like, my boss bought the microscope that came with some training, but it was a CD. And I was like, my CD, like, my computer doesn't even have a CD. And they're like, let me see if we have, they had like one in the front office that had the CD. And we're like, okay, what are we going to do? So the tech could be improved upon, I guess is what I'm saying. I was like, then you see everybody zooming, and I was like, okay, we can do this. Kind of around the same time, we found out we're going to be moving abroad, that I'm not going to be able to do clinical. And I said, okay, that's what I'll do then. I'm just going to go ahead and kind of transition into doing this. This will be what I do. So I feel like I wanted to, but I also kind of got thrust into the entrepreneurship. Maybe before I was ready, maybe I would have never been ready, which has been a whole new learning curve and fun, but that is completely different too. So yeah, so now that's what I do. My course is all online. I love to talk to people. That is something I have discovered I miss, is patient interactions. And like right now, getting to talk to you about hygiene stuff, like, I love it. I went to RDH under one roof last year, and I couldn't get enough of all the hygiene blab. And it was so fun, and just, soften it up of the biscuit. It was so great. And I don't get to go this year. I'm so bummed. Just, family things. Like, my oldest is looking for universities. My youngest is home from university. So,
Yeah.
but that's what I do now.
That's amazing, and I'm very sad because last year was my first time going to RDH under one roof. I'm like, "Oh my gosh, how did we not meet?" I know. It feels like it should have been fate with all everything else that we have
Yeah.
similar. Yeah, so I think that's your story is incredible. I will just say a couple things that really stuck out at me. You mentioned I had great office experiences. I think some of that is probably a testament to you and your networking skills and the type of human you are. And then also, like you said, you listen to your intuition. You have an experience and you're like, nope, that's not for me. I didn't always do that. I would have like my intuition telling me this isn't right, but I didn't have the confidence yet. I wasn't sure. Now I don't do that anymore. I'm like, I can feel it right away. And I'm like, nope, nope, that's not for me. But for a long time, I would stay in situations that I shouldn't. So I really want to commend you on that for trusting that internal compass. But also, the thing that I think is so beautiful about your story is how much you enjoy the profession, and also how much you learned along the way that eventually brought you to this phase where you're at now. And where you're at now may look different in 5 years, 10 years, 20 years, but the universal experience has been the sum of all the knowledge that you've gained and leaning into what you love and what you find interesting. And I just think I wish that more people would just see it's not that the journey can't be hard or tough sometimes, but it's that pivot, that slow little like you're just slowly turning the wheel on the right path, right? You're like, "You know what? That looks good." And you just keep driving towards that. And I don't know, I just feel like life suddenly unfolds in ways that you never expected, but you're feel fulfilled and happy, which is incredible. So I'm like super thrilled about your business. So tell us like what does a day in your life look like as an entrepreneur in Bangkok? I just want to kind of get the lay of the land here.
So it will involve, some early mornings as it is, you and I started at 5 a.m. today, which to be honest, I really am a sunrises, not sunsets kind of gal. So I would much rather be up early. It's kind of a natural fit for me. But it is this weird, if I'm going to talk with people in the States, and it's hard too, because I've worked with everybody from, Miami to California. I can remember trying to be like, wait, you're in Florida and you're in Washington State and I'm in Bangkok. How are we going to get on like our time zones to all be on the call at the same time? So it does get a little tricky. I feel like I'm constantly going, how many hours ahead? Like I feel like I'm pretty good at time zones now. So if I'm doing calls and things like that, it tends to be in the morning or in the evening, kind of depending on. So kind of midday, if it's like noon for me, maybe I'm out walking or maybe I'm doing something like that because it's midnight or 1 a.m. or 11 or something for a lot of people in the States. So yeah, normally if I'm doing calls, it's morning or evening, but it's all of that business stuff that to me is really hard. So my course is online. So for me, it's the really boring stuff that probably nobody wants to talk about. What platform are you going to use? Okay, so then you're researching what platform do I want to use, right? Like I have never been a teacher and instructor that made a curriculum before. Those are things I know how to educate to a patient, which was also one of the things that I found to be my favorite part of hygiene, after a while was just patient education. That's what I would tell students too when they're kind of thinking about what they want to do and they're drinking through a fire hose right now. When you get out later, even your day-to-day job and what you're doing, what part do you feel like brings you the most joy and fills your bucket, and see how you can maybe try to do that a little bit more or focus on that as far as this is the part that really brings me joy. I'm going to lean in on this and get more education in that. Maybe this just popped into my head, but it's not really, it doesn't have to, I can go back with what my day is, but this popped into my head. This is another advice that I would have, I think, for students. When you get out, go to CE that actually interests you. You can do more than the free CE. Go to the one that interests you. If you really want to learn about nutrition, go. Sometimes it doesn't even have to be for the CE. It is because I want to learn and I want to educate and I want to get more tools in my tool chest to share with my patients. So really kind of investing in yourself and your education. That's something that nobody can ever take away with you. And it's like you said, your life experience, right? You keep putting more and more things in your tool chest. And then before you know it, you really do have quite a few tools to offer your patients. So I'd say go to CE that you want. Do not be afraid to get involved with professional organizations that interest you. There are so many varied ones out there now. Get involved and be around other healthcare providers that love the same things that you do. I feel like I have learned so much from other hygienists, so much from other hygienists. And I feel like they're all so open and welcome. And we are all kind of, if you need anything from me, holler at me. If I can help you in any way, I will. If I don't know, but I know somebody that can, I'm more than happy to share their name. Back to that networking, right? But I would definitely feel like I would tell students or even just fresh grads, do these things for yourself. I love free CE and there's really good free CE right now. I feel like this is the best stuff. I mean, honestly, I'm like, There's just some really good stuff out there, but focus in on what you like. But yeah, so a lot of my time is spent initially was making the class, like, how do I do a curriculum? What would I do? For me, really trying to learn a new skill set. So that was tricky, to be honest. And then just constantly updating it. I feel like a lot of your time is also spent, talking to other people. I kind of have it easy. If you land on my Instagram page, you already know what I'm about. So you already know what you can expect from me. It has gotten to the point where people might message me or call me, and it's like 1 or 2 conversations, and then they're already going for it, doing it, loving it. I feel like I almost bother them more. It's like, do you, because like I said, I'm missing that. I'm like, "Do you need anything? How's it going? Do you need to talk? Do we need to Zoom? Do we need to FaceTime? Do we need to Instagram? What do you wanna do?" And they're like, "No, I got it." Like, it was all handled. And I always tell them too, "If you have a question, please let me know because you're probably not the only one that does." And I go right back into the class and build it in, like, build a topic around that. And so I feel like it's this living thing and it's been around long enough that I don't tend to get a lot of questions, maybe just initially, but it's more of how do I run a business, the boring back office stuff, and how do you market yourself? Like, then you have to do this whole, now you're your own marketer. What is that? I didn't take a single marketing class.
I'm just laughing because everything you're saying is everything I'm doing every single day, and every thought, every conversation I have with myself, I'm like, "Oh, what am I gonna learn today? Probably how to, like, code something." Like, I don't know how to do this. But that's, like, the fun part about entrepreneurship is every day is a challenge, but that's the hardest part of being an entrepreneur, and most of the time when you're a small business, they say you're bootstrapping it, like, you're doing everything, you're figuring everything out, and, I think the 2 things that you said that stuck out at me were really networking and investing in yourself. Those are 2 things that you can do to grow not only in your career but also within yourself, right? Because you're learning new things and you're investing in yourself and you're meeting new people. But at the end of the day with entrepreneurship, sometimes it feels like you're doing it alone, which is really hard. And I get what you mean about sometimes you're like, I just want to talk to somebody. Like, what's going on? How are you doing? I love that. So I feel like I maybe didn't get a good enough like question asked, but like your online course, it's all in how to use the microscope. Is that correct?
Yes. So it will be, what does a microscope setup look like? It is a brief history of microbiology because the other point to me of this course is, you know, time is money. Get up and running, know, be comfortable using this thing, and then let's go. So it is also how to implement it into a hygiene, like what's your workflow system? Because again, to ask a hygienist to do one more thing in that time, right? You're like, nobody's doing that. Nobody's having that anymore. But also discussing like, here's how you do it, prepping kind of the patient for it ahead of time. Like, I feel like one thing you don't think about is everybody's like, I'll have to brush my teeth before I go to the dentist afterwards. I'm like, please do not. That is not what we do. Do what you normally do, on Thursday afternoon or whatever. So if you don't brush your teeth Thursday at 2 p.m., don't brush your teeth today at 2 p.m. Like, this is not your normal. Roll in with your normal so we can look at it and discuss it. And if your normal is fantastic, get on you. And if it is not, then we'll talk about how we can get it to fantastic because that's the other great thing. But so there's things like that, and there's how to use it. And then it's really how to read those slides because, I try to do like the top microbes and then, okay, this is what they look like. Here's the video. We describe them. Here's what this means. Here's what we can do about it. How to talk to your patient, how to introduce the microscope, how to follow up, all the things that it can do, how it can add just so much production. If you look at the average right now, what is it? Almost 50% of the people have some type of periodontal disease. So in theory, if we were doing it right, wouldn't your practice, depending, but like almost 50% of the adult population be in some type of perio program or have had active periodontal therapy? So I tell people there's so many patients in your practice that have it. You don't even have to go look for new patients. They're there. We just need to get them on the treatment side. So we kind of go into things like that. There's a lot of resources in there as well. So there's tons of links to articles. I love to do like anything silly and fun. I'll just go ahead and add it in there. There's like, here's a desktop, like a free download. There's tons of templates, desktops. There's letters, some template letters on how to reach out to other healthcare providers, depending on what you find on the microscope. There's some templates, some downloads on oral hygiene instructions and everything, you can customize. So just to help streamline the whole process. Anytime I think of something fun, I'm like, "I'll go put it in the class. Plink, plink."
Like, I'm shook by your brilliance right now. Like, I'm a little bit fangirling over
No,
just
no, no.
this whole program. I'm like, I don't even have a microscope. I'm not practicing clinically right now, but I'm like, maybe I want a microscope. But also, I want to take this course. I think you did a CE through cloud. That I think that's where I attended and I first saw you, and I was like, oh,
So
this is
clever.
awesome, so cool. And I was, really thinking that when you go to the doctor, you get blood work, you get diagnostics run. And at the dental office, the hygienist does the diagnostics. Like we do the perio assessment. But the biggest thing that we're not doing is determining what microbes do you have. It's like if you have a urinary tract infection, what do? You take a culture, you see what microbes are there. You want to prescribe the right antibiotic for this. And it's like, that is what we work with is pathogens, and we're not considering like what pathogens you have. I mean, like in most traditional offices. So I am just beyond excited for everything you've done, everything you've built, that you're like willing and excited to share your knowledge. It's incredible. And I'm hoping that students who hear this, like they're interested in the microscope too, because the more people start talking about it, the more it becomes a regular thing, right? Like people are like, oh, we need this, we need this. So
Yes.
truly, yeah, truly amazing what you're doing. So do you also do consulting for offices as well, or is it all just through the program?
It's all just microscope through the program.
That's awesome.
I mean, again, I would love to just because I said I'm craving other dental human contact. I would love to do more with them, to be honest. Yeah, but no, it's just this for right now. And also kind of what you were talking about, I do feel like a lot of my time is spent just telling people this exists, right? Telling hygiene and dental offices this actually works. This is a thing that you can do, and kind of explaining. So I feel like getting out there, just getting the word out, if you will. There's a lot of time spent doing that. And another thing that I think is important is I feel like a lot of people know about salivary testing, and this isn't instead of. This is a beautiful, like they work in conjunction. And in salivary testing, you're going to know your specific. So I do tell people with the microscope, if you see bacteria, you're not going to know the species. You're going to know the family. Is it high risk? Is it not? Those types of deals. If it is a great tool to also give your patients more ammunition to go, we really do need to do that salivary testing, right? So you're like, hey, we do need to find out exactly the species of bacteria. The other thing is in the microscope, you can see white blood cells. So you can see if they're having an immune response. I think there's one other chairside test for white blood cells, but there's not another test that does that. So the microscope does something a little bit different as far as that goes. They also will show you if parasites are present. Not all salivary testing tests for parasites. And to be honest, that's a bigger deal than I think a lot of people really talk about. There needs to be more research done, and people agree with that. But there is also more research coming out that no, these are actually not commensals. They're problematic. They've done some not in vivo, but some in vitro studies where they talk about, hey, these can certain parasites when exposed to which one was it? It was metronidazole and amoxicillin can go into cyst form. So that's kind of problematic too if we're just putting them in cyst form and then they're hanging out waiting for the right environment and then they come out.
Yes.
It gives you a different kind of view, like maybe a backup big view, and then you use it for all of these other things. And also patients that have not really said yes to salivary testing, you can go, wow, there's a lot going on. I really, really think we need to do this. And I think people get scared that it's really expensive. The cost is the upfront cost. Yes, you have to get a microscope, and yes, you need to get trained on it. After that, I think slides, I didn't look today before we jumped on. I mean, I feel like 11 cents or something like that afterwards. So you will want to, it should be just like your dental chair. It's just always there working. If you don't really mess it up, kind of deal. Like it will last forever. You're going to want to get new countertops. You're going to want to paint, get new flooring or whatever. That microscope is still going to be doing its basic function. It pays for itself quickly.
Yeah.
So I feel like there's a little bit of it. People get nervous about that. And you're like, well, things cost, right? An intraoral camera costs. The microscopes do not cost like a scanner or anything. I mean, you can get a really great microscope that will last you forever for 6, 7, 8. There's one that I really love that's 10K, but it's more microscope than you really need for a dental practice, but you can still do it. And that's 10K puts a
Yeah.
ton of, I mean, it pays for itself quickly.
I was thinking like 40,000. So in my head, I'm like, oh, 10,000. That's not bad at all. Yeah. Um,
Thank you for that. The
eh,
bargain basement price of 10K. Let's go.
yeah. Well, and I guess I should probably clarify. I think I was so excited. I just kind of, I forget. I'm not the only one listening to you right now, but for our students, or future dental hygiene students, when we're talking about, a microscope versus salivary testing, the microscope is you take the sample, you look at the slide, you're looking at it right there in front of the patient in the moment. With salivary testing, you usually have to take the saliva and send it to a lab. Is that correct? And the goal of both of them is to see what type of bacteria you have. But the beauty of it, if you do the microscope first, you would know if you need to do more extensive testing, like a salivary test, but you can also take that and educate the patient. You can show them with their own eyes, like, hey, this is what we see. And that's why I love your Instagram because you're showing the videos and you can see them like swimming around. And I just think it's incredible, all through dental hygiene school, besides microbiology, I don't remember looking under a microscope in dental hygiene school. I don't remember looking at what the different pathogens looked like. I mean, I do remember looking at like histology slides, of the tissues and of like lesions, and maybe I'm just blocking it out, but I think that this is something that will become a part of our curriculum. I think as our scope grows, as we get more autonomy, I really do think that this is going to be something that will have to be added in because it's so vital to what we do every day. And I love your course because let's say a hygienist graduates and they step into the office and there's a scope there and they're like, "What do I do?" You're there, right? Like you're like, "I know here's exactly what you do." And like I said, I'm still fangirling over you. And the fact that like it shows you how to work it into your practice and everything, it's seriously incredible. So I'm proud of you. Like I'm so happy for you and yeah, I feel blessed to be in this space with such an incredible hygienist. Yeah. So, looking back over this entire career and all the things you've learned, all the things you've done, you've given so many great pieces of advice, but do you have any final advice that you'd want to give to maybe a future or current dental hygiene student?
Keep an open mind and be curious, like always be curious, always learn. And for me, this came with age is not letting someone's no bother you. Like, go ahead and ask. When you get to the point in your life where the worst thing someone can say is no, that's a pretty good place to be. Like, you can keep it moving because I've definitely had some, really that hurt and like, dang, that's kind of embarrassing no's. And that even at my age where I feel like if the worst thing that I hear is no, then that is a-okay with me. So I would say the no won't kill you. Just keep on moving and try to learn from your mistakes. That's, I feel like, a big thing. I don't know if it's a generational thing. When I was raised, it was failure was this horrible, horrible thing. You did not want to fail. And nobody likes to fail. Nobody likes to be told no, right? But it is what you learn from that experience and then how you move forward. Like there's so much education to be had in what we call a failure. So I would say don't let that be the end. Don't be afraid of no and don't worry about some failure.
Yeah, it's all part of the journey, right? I love it. Okay, so where can students find you on socials? Where can they find your online course? Give all the details.
So my company is named Dental Reveal. So if you just go to dentalreveal.com, I've got a website. I do most of my stuff on Instagram. It's just kind of easy, quick, and fun in videos. On Instagram, I'm Kristen King Dental Hygiene. So Kristen King Dental Hygiene. I'm on Instagram. I'm on LinkedIn. I'm trying to do more on LinkedIn, the whole entrepreneur is another thing to do.
Yep, we're always learning. Well, I just want to say thank you so much for your time, your story, and all you're doing for the hygiene community. I haven't had anyone on who does microscope. I haven't had anyone on like you who does these online courses. So, yeah, you're crushing it. Keep up the hard work. And thank you again for being here.
Thank you so much for having me, Dana.